Grandma. What you doing?
Trying to get my meds straight for this week. My doctor's decreased my medication for my this one right here.
Carbidopa levodopa medication is an anti-Parkinson medication used to help relieve some of the symptoms associated with Parkinson's disease. So the action of this medication, it helps increase the dopamine levels that are decreased with the Parkinson's disease. Dopamine is a chemical found naturally in the body, and it helps the person control movements, and it helps their emotional response. The right balance of dopamine is vital to both physical and mental well-being. The levodopa helps increase the dopamine level. Levodopa is converted into dopamine in the brain, which helps increase the dopamine levels and relieve some of the symptoms related to Parkinson's disease. Carbidopa blocks one of the ways that levodopa can be inactivated before it reaches the CNS and converted into dopamine. So both help raise the dopamine levels and decrease the symptoms of Parkinson's disease. Some side effects are confusion, the dark saliva and urine, alopecia, changes in sense of taste, increased libido, and neuroleptic malignant syndrome. Contraindicated in patients with angle closure, glaucoma, melanoma, or undiagnosed skin lesions, or if they have taken a MAO inhibitor therapy within the last 14 days. It is used cautiously in patients with severe renal, hepatic, endocrine, or pulmonary disorders, or history of peptic ulcer. Some things that the nurse should look out for when the patient is taking this medication. You want to observe the vital signs, especially changes in the blood pressure, because the patient can have orthostatic hypotension. Not want to stop this drug abruptly. You want to continue taking it and always talk to your prescriber before stopping it, and take as prescribed. You could have hallucinations like if you withdraw from the drug, so that's why it's important to always follow your provider's prescription all the way through and never change or decrease or increase the level. You want to take with food to minimize the GI upset, but you do not want to take with food that's high in protein because it can impair the effectiveness of this medication. You want to have your skin checked regularly. You want to report any abdominal pain, prolonged constipation, nausea, vomit, fever, or black tarry stools to your provider, because these are things that need to be corrected immediately.
Well, thank you for explaining this to me. Now I have a better understanding of this drug and will continue to take it as it prescribed.